Two critical self-awareness understandings about your language. And they are the placebo and nocebo effect. Doctors doing research on new treatments for disease often give one group a placebo, while the second group take the new medication. Those in the placebo group usually believe that they're obtaining the real new medication, and their own hopeful attitude may bring about improvements in their condition. So the key words are hopeful attitude. Thus, for the real drug to be considered effective, it must produce better results than the placebo. Placebos have another use as well. Doctors who suspect that a patient's physical symptoms are psychologically produced may prescribe a placebo in the hope that the medically produced symptoms can also be mentally cured. A nocebo is a harmless substance or treatment that when taken or administered by a patient, it is associated with harmful side effects or worsening of the symptoms due to the negative expectations or the psychological condition of the patient. Some examples of the placebo effect. Placebos can reduce pain by 30%. Placebos have been found to reduce the impacts of depression in 30% of patients. Placebos have been found to improve 50% of patients who are suffering with anxiety disorders. Placebos have been found to be effective in reducing cough symptoms in about 25 to 40% of patients. Placebos have been found to improve erectile dysfunction in approximately 30% of men. Placebos have been found to improve the outcome of 40% of patients with irritable bowel syndrome. Placebos have been found to improve the symptoms of Parkinson's disease in between 10 and 40% of recipients, i.e. the patient. Research discovered that the placebo was 50% as effective as the real drug to reduce pain after a migraine attack. Additionally, in regards to insomnia, a study found that 40% of participants with insomnia experienced improved sleep quality after taking a placebo pill. So let's have a look at nocebo examples. In regards to pain, studies have shown that up to 26% of patients may experience side effects from a placebo. Up to 39% may report worsening symptoms due to negative expectations, i.e. it's their thought process. And up to 60% of patients may experience an increase in pain after being informed about the potential risks. Again, it's their thought process. These statistics highlight the significant impact that belief and expectations can have on physical health outcomes. It was also identified that branded drugs had a different impact in regards to someone's thoughts versus generic drugs. In a study, it was found that 45% of patients reported experiencing side effects from a generic drug compared to only 20% from a branded drug. In regards to beliefs, it was found that 23% of patients developed symptoms of an ulcer due to their belief that they had one, even though they were not diagnosed with one. In another study, it was found that patients experienced side effects from placebos 25% of the time when they believed it was an actually active medicine. Studies have shown that a person's language can have a significant impact on their psychological and physical well-being. Research has found that using positive and empowering language can have a placebo effect. meaning it can lead to improved outcomes even if there is no actual treatment involved. In fact, 70% of the effect of a placebo is attributed to the power of positive language. On the other hand, negative language can have a detrimental effect on a person's health and can contribute to the nocebo effect, where symptoms worsen by the belief that the treatment will not work. Therefore, it's important to be mindful of the words we use when speaking to ourselves and when communicating to others. Your language is observed by people like me, selectors. Your language is observed by managers. Your language is observed by business clients. Your language is observed by the staff. And my proposition to you is that in the game of life, the nocebo language is not a great card to play. Buddha said, all that we are is a result of what we have thought. What we think, we become. And thinking is a language, and verbalization is a language. The best language to use is placebo language.